I am Dr. Akshata Pawar. I am a consultant general and laparoscopic surgeon. I have around 18 years of experience in my field. So I'll be discussing a few topics on general surgery, especially those related to female health. So let me tell you something about breast. So many of the women face some breast issues which may be age related or because of hormonal imbalances. So we'll talk about fibroadenomas, fibrocystic diseases. Now these fibroadenomas are usually common in the younger age group around the age of 20 to 14 to 20 years, and these are non-cancers. So they are not cancer causing, and they will present with a painless solid or rubbery swelling, and it is freely mobile in the breast. So how do we evaluate is that we after examination we do an ultrasound, we see what it is, and if the next test what we do is a fine needle aspiration cytology, which is what a sui pariksha, and according to the this thing, and if it is small in size then we treat it with conservative treatment. If it is bigger then the patient will need surgery. Similarly, fibrocystic diseases, they are also non-cancerous, but these are more common in the middle age group, and usually they will present with some lumpiness or thickness or swelling and pain just before the periods. Cysts are usually fluid filled. It may be a watery cyst or it may be filled with some yellow colored liquid, and single or multiple in size, which can present in one or both the breast. This is also because of hormonal changes. It's non-cancerous. Again, we evaluate it further and we treat it usually with conservative treatment, no surgery required. Breast infections are more common in breastfeeding mothers, and usually if it is diagnosed slightly early, so if you come to the doctor slightly early stage, usually you will have symptoms of pain or fever or redness and swelling, and if you come at an early stage then we can treat it with antibiotics. If it is slightly late and it has formed an abscess, then you will need a surgical drainage of that pus. So prevention is the best form of cure. So how do we avoid it? So what is important is the correct technique of breastfeeding. It is important that the baby latches on. So the entire areola and the nipple should be inside the mouth. If not, what happens is the nipple develops cracks and ulcers, and the bacteria from the baby's mouth can track inside through the nipple and can cause abscesses. So that's why it is important to follow the correct technique. What is most important nowadays is everybody has an awareness about breast cancer. So if any time you notice any change in the shape or size of the breast, if there is any painless lump in the breast or the axilla, if the nipple has suddenly turned inward, if there is any sudden watery or bloody discharge, if the skin in the breast is showing any puckering or like an orange peel appearance, so these are the times when you have to consult your healthcare professional. Okay, it has to be evaluated further. There is treatment available. So yeah, stay healthy. Thank you.